Welcome to the Exam Room Live, brought to you by the Physicians Committee. Hi, I am the weight loss champion, Chuck Carroll, and this is the healthiest online. Hey, hi. There we go. The healthiest half hour anywhere online today. Appreciate you joining us right here on Facebook and on YouTube. Coming up today, we're going to be putting meals and mental health into focus. How the food you eat affects how you feel. And joining us to discuss will be Dr. Melissa Mondala. Very important topic that we have not yet covered on the Exam Room Live. Dr. Mondala, appreciate you being here with us today. Plus, Dr. Vanita Rahman, she will be here to talk about how a plant-based diet can not only help you lose weight, but keep that weight off for good, and a couple of interesting and exciting programs to talk about as well. Dr. Rahman, always a pleasure to have you on the show as well. So much to discuss here. Such a great topic. Plus, Dr. Rahman, she's going to be sticking around to answer your questions when we open up the doctor's mailbag. So go ahead, send yours in now by posting it in the comment section, or you can always find us on Twitter or Instagram by using the hashtag ExamRoomLive. But first, why not get caught up on the latest happenings? Here are your health headlines for Thursday, September 10th, 2020. There was a significant uptick in the number of coronavirus-related deaths reported Wednesday, nearly 1,200, the highest total in more than 2 weeks. It's possible, though, the spike is a result of underreporting over the Labor Day weekend. The U.S. has now recorded more than 190,000 deaths and 6,360,000 total infections. If you need another reason to step away from your phones and your computers, well, a new study finds that exercising for as little as 2 minutes and up to an hour can boost the brain's ability to concentrate and retain information for up to 2 hours in young adults. Researchers included walking, running, and bicycling in the study that is published in the journal Translation Sports Medicine. Regular exercise has also been proven effective for brain health among older adults and can play a key role in preventing dementia. And finally, young adults who have faced stigma about their weight are more likely to be depressed and 3 times as likely to binge eat as a way to cope with stress during the pandemic. Those are the findings of researchers at the University of Connecticut who say the unhealthy coping mechanism is putting those feeling stigmatized at greater risk for COVID-19 because of the risks associated with the virus and obesity. Researchers also say the increased likelihood of binge eating continued even after lockdown restrictions had been lifted, and that both men and women were affected. And to that end, many of us use food as a way to self-medicate, often to our own detriment. If we're depressed, we eat to try to feel better. Ice cream and pizza, they have long been thought of as over-the-counter forms of Prozac. But alas, the problems we face are still there long after the last bite is gone. And all we're left with is a larger waistline and a deeper, darker plunge down the proverbial hole. But what if we were reaching for baked kale chips instead of potato chips? Could that lead to a happier and healthier life? For the answer to that, we turn to Dr. Melissa Mondala. Dr. Mondala, thank you so very much for joining us today.
Yes, it's my pleasure, Chuck. You nailed it on the head. There's so much of a big connection with mental health and the things you eat and how you move. So thank you for that warm introduction.
Absolutely. My first question to you really is, does that pint of Haagen-Dazs actually do more harm than good here?
Yes, absolutely. You know, there's dairy in it, right? And there's arachidonic acid. There's so many studies that replicate the fact that it is a pro-inflammatory substance, and people tend to get more depressed, more anxious, even more overwhelmed and less focused. And so you really got to pay attention. That the sugar, the additives, all cascade into a place of where you're getting more mental distress.
So you use the term inflammation. A lot of times people think of inflammation and they think about joint health and just overall physical health, but not necessarily mental health. How does inflammation play into the mental aspect of things?
Absolutely. So the neuroinflammation is huge, right? So you have arachidonic acid, it's crossing the blood-brain barrier. But in addition, your gut health is equally important. So about 90% of the serotonin is in your gut, and about 40% of dopamine is in your gut. So you have the reward pathways. You also have the pleasure, the motivation. But when you have inflammation, all of those are dampened and really just messed up in a way where you're getting the complete opposite. So when you're deprived of healthy plant-based nutrients, nutrients, you actually get more depressed, more anxious. There was actually in a Minnesota study back in the early 1900s, they already started to test this. And so where they were lacking their antioxidants, their minerals, their vitamins, and they ended up getting more hysterical, more psychosis, more depressed, and apathetic. So there's a great link of your mental health and your gut health.
Did you say that 40% of the dopamine pathways are in the gut?
Yes, it is. It's pretty fascinating because in your guts, you would never know that what every time you're ingesting these pro-inflammatory states, you're actually feeding those your microbiome a sense of more inflammation that just goes into your entire body. So people who get, I have patients all the time. I would say case after case who are severely depressed and anxious, and when they're eating the standard American diet, they end up getting more, not only more brain fog and worse depression and anxiety, but they're getting that joint pain, like you mentioned. They also have another co-host of diseases like hypertension, hyperlipidemia. You usually, with a primary care doctor, you see 10 problems at a time in one patient. It's never just hypertension. It's usually hypertension and depression, anxiety. And there's actually a really great study which shows in hospitalized patients really doubling the effect of depression because they just had a stroke, they just had a heart attack, they just had even cancer diagnosis. And so you'll see there's a strong correlation with your mental condition, what you eat, and even your existing conditions as well.
All right. Well, I want to stick on the dopamine thing here because that
Yes,
to me just seems to be huge. Because
right.
when you eat these high fat foods, obviously it triggers this dopamine response, right? We eat them to feel better. And if so much of that is centralized in your gut and you eat these foods to feel better, but it's, as we said, it's doing more harm than good, that creates such a vicious cycle. So, what can we do to break out of that?
Absolutely. So I kind of give the scenario of the addiction triangle where it's one side is that dopamine response where it's really that pleasure and reward. The other side is that habit, and it's more of that, the physical dependence because you go to the break room and there's a piece of candy. You go to the kitchen and then you have your pantry and there's all kinds of snacks, and the other side is that emotional response because you feel like it suppresses your depression, anxiety. If you're having a hard time with the dopamine, I say pay attention to other sides of that triangle. Try to build new habits. Look at your environment and try to remember, okay, I'm not going to go into that break room as often as I would, and maybe instead let's just go for a walk with my carrot. And you're breaking that cycle. And even the emotional component, when you're able to get some support through your friend's family, through a psychologist if needed, and you're really trying to rewire that addiction triangle. And then essentially that dopamine reward response will be less and less overwhelming, and you're able to find new substitutes to reward yourself.
Let's talk about the difference. I mean, we all have bad days, right? I mean, everybody has a bad day on occasion. That's just part of life, right? We all go through it. But there are a significant number of people also who suffer from clinical depression, and the two could not be any more different. So, how then does food affect clinical depression, and can nutrition actually help alleviate those for symptoms for those who have been suffering from that long term?
Absolutely. So clinical depression, I like to just hit on that a little bit harder because sometimes people say, well, I'm super depressed. That's just a term. But if you have clinical depression, that means at least 2 weeks or more, and you're also not suffering from grief. And clinical depression is really, there's a lifetime prevalence of 25% of I would say in our population. So there's a high rate of depression and even anxiety. And like I said, if you have a comorbidity, it actually doubles. In COVID times, they did a study specifically with the mental health, about 1,400 participants, and it actually tripled during this COVID time, which totally makes sense. And so when it comes to answering your question, Chuck, with the nutrition, there's actually been some studies specifically looking at plant-based foods. And plant-based foods are the ones that have the tryptophan and the tyrosine. These are the essential amino acids that get converted to our dopamine and norepinephrine and serotonin. And so these are key factors. There also are some studies with folate, especially, and some of your B vitamins that in plant-based foods that can also be adjunct therapy. Folate too, like I mentioned, is another one where that's a great combination with the antidepressant. And then omega-3s in your hemp seeds, chia seeds, and flax seeds are excellent sources. Sometimes you need a little bit more through a supplement. For example, there's a study about 60% I would say I think it's EHA and DHA. So 1640, you want that ratio to be very good. But I would say there's so many elements, and you also have to know what you're not eating, because what you're trying to avoid is really the inflammatory cascade, and really it's that one kind of pushes it over into where you're just getting worse, and you get stuck in that depressive mood when you're just really just kind of self-inflicting more of that inflammation in your body when you eat those processed animal products.
So many of the people who have come on this show and have lost a tremendous amount of weight, really improved their health, have said that they've been able to get off all of their medication. And a lot of time, that medication includes antidepressants. I'm curious, though, is it a fact that they're able to get off of the antidepressants because they're being kind of their overall health is improving and that gut bacteria is getting healthy there, or is it just because they like what they're seeing in the mirror, they're feeling good about themselves, they know that they're on this healthier path? So what is the ratio there of why they're able to get off of the medication?
Sure. So I would say this is a bi-directional approach, because when you naturally you're taking care of your body, you're having extreme better self-care when it comes to meditation, you're exercising, it's the whole lifestyle factors where you're eating good, you're going to not only feel elevation in your mood, you're going to, like you said, you're going to drop not only the weight, but your depression, your even high blood pressure, your diabetes, so many other medical conditions are alleviated. And so yes, there's a great component where you can minimize medications and potentially take patients off. And I've done that in a very stepwise function. Other times there's patients who have severe anxiety and depression, and what we do is just have some medications, and then when they fix the lifestyle factors, eventually those go away. So I would say it is definitely possible. And I would say anxiety is actually, they say it's the hardest to treat, but I would say it's actually not when you're really using lifestyle as a prescription. Usually lifestyle is something skipped, and that is not the first line, but when you use it as first line and gold standards, you're able to really help those with those anxiety and depression conditions, even ADHD and bipolar patients I've used.
All right. Well, let's talk about anxiety there for a second, because we define clinical depression as not being a bad day, but something that is sustained and lasts for 2 weeks or longer. So we also in life always have these anxious moments. Everybody's susceptible to them. But when does that go from being just an anxious moment into you have an anxiety disorder?
Right, absolutely. So, like I said, with depression, you're having it 2 weeks. Same thing with anxiety, where you're having it not necessarily the time frame, but 2 to 4 weeks, but more so where it's very disrupted, where they can't function in their day to day, where they're so anxious in their thoughts, they're not able to talk like what we're doing now. They're not able to go into the grocery store, even communicate with their friends. It's to the point where their work and their life is being altered, and they're feeling that sense of overwhelmingness, that nothing in their present being can be fixed. And so that's where we have to really come in and support them by cognitive behavioral therapy, by lifestyle factors, and then if needed, the medication. But I would say you really have to go in there. With depression, it's easy because you get even postpartum depression right after their pregnancy, you're able to see certain time frames, and you can see the change in sleep, the change in I would say appetite, the hopelessness. But with anxiety, it's such a, I would say, deep, I would say, disordered thinking that needs to just be worked with. It's definitely possible to overcome. I've seen it every day with my patients, and it's usually because they have reflux. So reflux and GERD and anxiety are the two, and IBS actually three are the three most common conditions that I see in my clinic over and over. But when you treat the anxiety with lifestyle medicine, with plant-based nutrition, you're able to actually come down with all those symptoms and take away those medications, as I mentioned.
Yeah, I want to ask you specifically about healthier foods in just a second, but let's talk about, whether or not a trip to the drive-through then can actually trigger a bout of depression or trigger an anxious episode. Is food that powerful that one trip to the drive-through or just binge eating on a pizza one time, an entire pizza, could that actually send you into a downward spiral?
Yeah, and I think we have to be very careful because that one event is really just not one event. It's a series event over time. Most of the time, patients have incidents of trauma, or we call it adverse child events, where they were just disrupted in their upbringing when they've had to move occasionally, or they were a gymnast, or they had high expectations while they were growing up. And so it really is the binge eating at the food, at the fast food you're pulling in there. It really is a unhealthy way of coping. They're actually going into a moment of maybe regressing from the past because they had a severely high stressful time that they just don't know how to cope. So actually, that it can be a downward spiral, but sometimes it's not. Sometimes it's spontaneous because they're bored, and it's just that habit because they're just either celebrating or trying to de-stress. So there is definitely a combination of reasons why people go to that drive-through for that instant fix.
What are the foods that you think are really the ones that we should really be on high alert about? The ones that we absolutely should avoid to not even tempt or trigger in the least these types of episodes?
Yes, for specific anxiety, I would say so high sugars and even caffeine. I have patients who are on 4 cups, even two big, large containers of coffee. But I would say even the 1 to 2 cups of coffee I've seen um, really affect patients where they're actually having palpitations, which actually resemble a panic attack. They're getting sweaty, they get numbness and tingling. And I work with patients where we're able to, okay, from 2 cups, can we go down to 1 cup or half a cup, or maybe substitute it with a nice herbal tea? And you would be surprised that their migraines go away, that their anxiety and their panic attacks actually start to diminish because they're substituting it with something better, like berries. I'm a big fan of berries, and we all are. And then with our chia seeds and flax seeds, because they have the omega-3s, and then any folate-rich foods are much more excellent. So those green leafy vegetables. So when they're able to cut down on sugar and caffeine, especially the processed additives, you look on the label, there's tons, like 10, 15 ingredients you can't recognize. That's a big no-no for me. And I say, let's go for the whole foods.
Ooh, sugar and caffeine, those are the big no-nos. I really expected you were gonna go with meat and dairy. This is, yeah, this is something new here. Okay, that's very interesting to me. So what then would you say are the foods that, I mean, you just mentioned berries. Are there some berries in particular that are really more beneficial than others?
You said dairy, is that correct?
I did say dairy.
Yeah, so I would say dairy, definitely with dairy. So we know that eggs have the arachidonic acid, right? So that's more neuroinflammation. And then with cheese, it's so crazy with cheese because if you think about it, they're the highest source of salt, but opium, and that's why they're more addicting. And I would say that's a big no. So cheese and egg, let's try to throw that out of the water, and even milk. And I'm plant based, and I say all of that can really just inflame your whole entire your gut and your brain. If I would go in order, I would say sugar, caffeine, and then the dairy. Those three, if you can tackle those in a stepwise manner, then later on go for the animal products. You'll see huge wins there.
All right, so those are the three no-nos. Give me three foods that we should be gravitating to if we want to improve our mental health.
Absolutely. And once again, I said berries before. If it was another one, I would also go for the beans. So beans are excellent. Beans have, there are studies with beans having high fiber, high folate, B vitamins, just like I mentioned, and it has those key nutrients. You can't go wrong because beans have the entire package, and they help with any other disease. So all forms of beans, and I can keep going on when it comes to garbanzo beans, kidney beans, all of those. But berries, I still say is number one. Your beans, and then your types of seeds. You really have to have a good variety of seeds. Just like there's the different colors of the rainbow when it comes to fruits and vegetables. Let's try to go for the diverse beans and the diverse amount of seeds.
All right, and real quick as we wrap up, when it comes to food, if we start to treat this a little bit more with nutrition across the age spectrum, can everybody reap benefits from improving their diet here?
Oh, absolutely. So as early, I deal with kids from as the moment they're born to the moment they pass. So from womb to tomb, that's what we call a family medicine doctor. And you actually see, even in the moms, you're able to see benefits because unfortunately, the first things kids want is candy, right? That's their reward. But let's try to give them those beautiful fruits, if it's peaches, if it's some type of walnut. And that's really what we see because you can actually get depression and anxiety at a very young age. They're just not good at communicating it. So toddlers, not you may think they're tantrums, but they're really just not able knowing how to cope. So instead of passing them like piece of candy, I always tell moms, let's just have them kind of teach them how to kind of relax and do an activity and breathe through it by doing something fun, but also giving them a healthy treat as a reward. And you can learn so much by just doing that, teaching them to at all ages to zen out, we call it, just have a place of mindfulness, of relaxation, and then you get a reward. Why not? We're human beings, we love rewards. Let's do it with healthy foods.
All right. Dr. Melissa Mondala, thank you so very much for your time. You are fantastic. I would love to, I feel like there's so much more that we could talk about. So here's what I want to do. I would love to bring you back on the Exam Room podcast where we don't have time constraints and we can really stretch this out because there are so many things that I still want to ask you. So let's do this again sometime very soon.
Yes, my pleasure, Chuck. It was great being here. Thank you.
All right. Check her out online at melissamandalamd.com and give her a follow on Instagram, melissamandala.md. You will not be disappointed. But right now it is time to open up the doctor's mailbag. And for that, we welcome Dr. Vanita Rahman back to the show. And this question, this is a big one today and kind of goes hand in hand with what it is that we've been talking about all show long here. Dr. Rahman, Stephanie is asking, and this is just fantastic. I just found Forks Over Knives on Netflix, and I'm new to being vegan. I want to lose about 50 pounds, but my friend told me that people who go vegan are even more likely to gain the weight back than any other diet. Is that true?
Oh, that's so unfortunate that you've heard that, and I'm glad you're bringing this up because actually the opposite is true. What we know from innumerable research studies is that people who go on a plant-based diet actually lose weight and they have a much better chance of keeping it off. So let's be clear about this. You know, any diet can help us lose weight temporarily. The problem is it's hard to keep the weight off. The other problem is we may lose weight, but our health may not necessarily improve. For example, we know with paleo diets or keto diets, people lose weight quickly, but most of that is water weight and their cholesterol levels go up. They suffer from more constipation. Their risk for cardiovascular disease increases, mortality increases. So the weight is going down, but the health isn't improving, and that's not what we want. What's really great about a healthy plant-based diet is that not only do we lose weight, we keep it off, and our health improves. Now, I think where the confusion comes in is not all plant-based foods are healthy, So let's face it, like potato chips and apple juice, they're plant-based foods, but they're not exactly healthy. So what we are talking about are nutritious plant-based foods. And where things get tricky is keeping them low fat, keeping them whole grain, minimizing processed foods. And when people eat this whole food plant-based way, they lose weight and they keep it off.
Yeah, and you know what? I think that you were just touching on that. I mean, education is so critical, and that's why you have this 12-week weight loss program that's beginning September 26th. I love the fact, also, Dr. Rahman, while we're going to talk about this, that this runs right up to the holidays, because that gives people, I mean, it's crazy we're already talking about that, but it's a 12-week program that starts here on September 26th, and that brings you right up to the holidays, and it gives you a big head start on New Year's resolution. You're going to get like a 3-month jump on everybody else. And also, though, when you think about holidays, you think about cookies and cakes and carbs. And so one of the things that you're going to be touching on in this course is teaching people the difference between good carbs and bad carbs. So, how can someone find out which carbs are actually healthy for them?
Yeah, this is something that causes so much confusion because carbs have sort of been vilified as being the reason why we're gaining weight and our health is deteriorating, but carbs aren't really the issue. It's because carbs are also nutritious. For example, people don't realize that fiber is a carbohydrate. And we all agree that fiber is essential and that most people don't get enough fiber. So it's not the carbs per se, it's where we're getting those carbs from. And one thing that we really focus on the program is getting whole grains, minimizing processed grains, and explaining what the difference is. For example, most people may not know that brown rice is a whole grain that's nutritious, but let's avoid the white rice, which isn't so nutritious. Let's eat the fruits, but avoid the fruit juices. So these are all the things that we go through so that people feel comfortable enjoying carbs because they are an essential part of our diet. The bulk of our calories should be coming from carbs, and people are so afraid they'll gain weight. And this is something that we really focus on big time in the program.
Oh man, I love carbs so much. The healthy carbs like you were talking about. But also, mentioning the holidays, overeating, that's another big one. Thanksgiving and holiday dinners. And I mean, you're talking about food piled a mile high on the plate. And I'm sure that during this course, you're also going to be talking about some ways that you can actually make sure that you're not getting that big old mound of food on your plate and keeping your portions under control.
Absolutely. That I love the fact that we are going right up to the holidays because, well, Halloween is a little bit different this year, but we'll be going through Halloween, and we are actually even going to hold our class on Saturday of Thanksgiving weekend because that can be a challenging weekend for a lot of people, whether it's a virtual Thanksgiving or getting together with family. It can be tough. It can trigger a lot of emotions. It can trigger a lot of eating, and maybe make it hard to stay with the plan. So we are going to be meeting so that we can support each other, we can hold each other accountable, and make sure we stay the course. And you're absolutely right, holidays bring up a lot for people, and we actually will spend one of our earliest classes talking about emotional eating and food addiction. And in fact, Chuck, I'm so glad that you will be joining us to share your experience because, it's really telling how much diet and nutrition play such a key role in our health. And I think people would benefit greatly from hearing about how you overcame some of your challenges.
Yeah, I love being able to share tips and tricks and things that I've learned along the way. But you were just it never ceases to I never put the two things together here. Is like you get together with family, and a lot of times that does lead to stress, anxiety, depression, upset. And what is one of the coping mechanisms that we were just talking about with Dr. Mondala? Binge eating. And maybe then that too is part of the reason why we pile food that mile high on our plate, just as a way to just kind of zone out and try to deal, with the crazy, step family or the aunts, the uncles who just drive us up the wall.
Absolutely. And Chuck, for some people, it's the opposite. They may not have family or friends to get together with, and that can trigger emotional eating. So it's really important as we head into this holiday season that we are there to support each other, give each other some helpful tips and tools to work with, because eating better has never been more important, especially when we're talking about COVID-19, where we know these chronic conditions play such a key role, and then they can make the difference between life and death, literally. So it's really important that we continue to eat well.
So you're doing the 12-week course that begins here in just a couple of weeks. You can head over to pcrm.org/weight loss program to sign up for that. But in addition to that, you're also doing a weight loss study. And this goes right to what it was that the question was asking about today is, can a plant-based diet actually help you to keep that weight off long-term? You're actually putting all of these tools to the test. Talk to us a little bit about this study.
Oh, so the study is terrific because we are actually providing people with objective data that they can track in their health. So we will be doing a body composition analysis for them before and after the program. So they not only know what their weight is, but they know how that weight is distributed. How much of that is lean tissue, how much of that is fatty tissue. And people really like to know, where is that fatty tissue located, because they have a sense of where they feel it, but the DEXA really shows us that it is here, it's there, and it's so helpful. And then we will repeat that again at the end of the 12 weeks to see how things have changed. And it's really amazing to see the results that people get when they lose weight, that it isn't just water weight or lean tissue, they're actually losing the fat tissue, and it's very empowering. And the other thing we'll do for them is we will check their lipids, we'll check their cholesterol, and we will check their hemoglobin A1C, screening them for diabetes or prediabetes. Again, all of these are very responsive to diet and lifestyle changes, and we will track them and show our participants how they are impacted by their diet.
And one of the things that never ceases to amaze me is just how resilient the body can be and how much it can improve over 12 weeks, which really does. It doesn't seem like a whole heck of a lot of time, but to the body, I mean, that is a whole lot of time to improve.
Absolutely, Chuck. And for a lot of people, 12 weeks is enough to be a life-changing experience. They can fundamentally transform their health and their trajectory going forward. So it's plenty of time to make meaningful changes.
All right, pcrm.org/weight loss study to sign up for that. And you do need to live in the Washington, D.C. area to be a participant in that, correct?
Yeah, so you don't have to live in this area, but we do need you to come in twice to do the DEXA with us. And so you could be in a surrounding area as long as you're comfortable coming to us. We are happy to take you. But all our classes will be virtual so that people don't have to come in on a weekly basis.
You've said DEXA now a couple of times. What is DEXA? I can't be the only one that's wondering that.
Oh, I'm glad you asked me that. So a DEXA is basically a type of an X-ray machine, which takes about a minute, 2 minutes to complete. People lay on a flat bed, and it's commonly used to measure bone density, but it's also a great research tool to measure body composition, and it assesses each plane of the body, and it gives us very useful information about what the muscle tissue looks like, what the fatty tissue looks like. Very helpful, and it's painless, minimal radiation exposure, no more than a typical chest X-ray, and very quick to do.
I bet that's fascinating to look at. I bet that is just absolutely amazing with, some of the things that you're able to glean from that.
It is. We all did ours when we were training for this, and it was just fascinating to see where our composition was. We were all super excited to see the results.
All right. So here's the deal. If you're able to make it into the DC area twice, sign up for the study, pcrm.org/study. If you can't make it to DC, but you can still get that 12-week course, and go to pcrm.org/weight loss program. Dr. Vanita Rahman, thank you so very much for joining us today.
Thank you, Chuck.
All right. Now, before we go, I need to remind you that there is a brand new episode of the Exam Room podcast that is out today. It dropped overnight. I had the opportunity to chat with esteemed cardiologist Dr. Kim Williams, and the name of today's episode was Heart Health, Nutrition versus Exercise. He walks us through really and gives us a surprising answer. How do they compare when it comes to the health of your ticker? So we get an opportunity to give them a head-to-head comparison. Plus, we talk a lot about tennis because right now the US Open is in full swing. And Dr. Williams, in case you didn't know, he is a former tennis pro. So we talked about Serena Williams. Here she is at this advanced age for a professional athlete playing tonight in the US Open semifinals. This is astounding what she's been able to accomplish for 2 decades now in her career. So how much does her diet have to play with her longevity and her success? So we break all of that down. And as a bonus, he tells this really incredible story about being at another tennis event, a major over in Australia a few years ago, where a fan actually collapsed in the stands and he was able to save them. Really cool story. Interesting information. I mean, this topic about nutrition and heart health and exercise, how they all tie together, very fascinating. So head over to the Apple Podcast or Spotify, Stitcher, wherever shows are available. Look for the Exam Room podcast by the Physicians Committee. Hit that subscribe button. And if you enjoyed the episode, if you would leave a 5-star rating, that would be fantastic as well. Now, coming up right here on the show tomorrow, we're going to be taking a trip down to Plant City with Kim Anderson. Yes, Plant City, where the grass is green and the kale ain't gritty. Plus, Dr. Neil Barnard, he's going to be here as well as we wrap up the week. But for today, that's going to wrap things up for right now. My thanks again to Doctors Melissa Mondala and Dr. Vanita Rahman for joining us. And to you, my exam roomies, for joining us as well. My hat is off to you as always, as it is for the crew behind the scenes who makes the show happen. On behalf of everyone here at the Physicians Committee, I am the weight loss champion, Chuck Carroll. Thanks so very much for watching today. And until tomorrow, stay safe, take a stand, and keep it plant-based.